break. We hope you enjoyed them. First of all, we would like to thank Dean Sayer for coming to the lecture. And we would like to introduce our two guest speakers for a one-of-a-kind lecture. Dr. Kamal Badr and Dr. Fuad Ziyadeh are two very well-renowned scientists, both in our community and worldwide. Usually in such conferences, it is customary to introduce the speakers with their educational and academic background. But as they will be taking us through their journey, we have decided it is best we stay brief.
Okay. So Dr. Fuad Ziyadeh is a professor of medicine and biochemistry at AUB. He is the chairperson of the Department of Internal Medicine. And Dr. Kamal Badr is also a professor of medicine. He is the associate dean for medical education. And he is also a professor of medicine adjunct at the Johns Hopkins University. It's a great honor and pleasure to be introducing both of them. And please join me in welcoming them to this lecture.
Okay. Why don't you say that?
Of course, thanks very much for this honor. Kamal will start, then I'll follow, then Kamal will make closing remarks, and I will do the same. Also, I didn't see anything that he was going to say, and neither did I tell him what I was going to say. So let's see and compare notes, and it's a thriller for me and Kamal to see what we are going to be talking about. So Kamal, in alphabetical order, you start.
I have some documents here that I needed to get. So thank you, Fuad. This is, I've never done this before. I don't think anybody has. To do this dual sort of science as well, research focused, but as well with a little bit of a personal touch. You need to know that the personal touch was at your request, not ours. Okay, so now what was done with my presentation? Wait, no, at least it was. Okay. Okay. What I thought I would do today, which I think is what the organizers wanted, is to do two things. Is first to tell you what I have learned from my own personal journey on what it takes to be successful and happy in medical research, or content. I think the word happy is a bit... So this will be my own sort of lessons of life that I want to share with you. This is, I think, what friendship is all about. As was said, you know, there's no greater love than this, that a man or a person lay down his life for his friend. And what does that mean, lay down your life? It doesn't mean you have to go and kill yourself, but it does mean that whatever part of your life you think is good or valuable, you need to share it with those people whom you think are your friends. And for us today, it's not so much about Fuad and me, but it's about him and me and all of you. And we're going to share with you what we have learned and some of the lessons of life. And at your request, we will. This presentation will be peppered with pieces of data that may or may not be of interest to you, but which have to do with my friendship with Fuad and how it has impacted my research journey. And because I think there are some lessons to be drawn from that as well. Now, after this, in my second part, after Fuad speaks, I want to reflect a little bit on the meaning of success in research, and perhaps a word about friendship. Well, I think what it takes to be successful are, in my mind, five principal things. I forgot how many. But the first one about them is that you have to be amazed about life. If you're not amazed about life, you're not going to really have the stamina it takes to continue in research. And just to give you an idea of what that means, here is a sperm entering an egg, which is an organism which at some point is going to develop into this fantastic transformation. And if that doesn't amaze you, then it's unlikely you're going to really have the oomph to continue to work in research. And if that doesn't amaze you, then maybe this will amaze you, that this thing over here can become something like this, and then that can also transform into it. Now, these are all one being, okay? And this is the wonder of biology. Once you get that wonder, and you have to get it early on in your life, then you've gone the first step, I think, in the ladder towards research success. But definitely being amazed is not enough by itself. In addition to being amazed, you have to be curious. And what that means is you have to want to know why things happen in a certain way, and not just look at them and wonder. You must have that passion for curiosity that Einstein said was the only thing he really had. And to be curious can sometimes lead you to things you may not want to go. But a curious brain is a brain that you somehow are born with, I think. In my own case, it manifested itself by me bringing frogs home and dissecting them and getting a microscope and looking at everything I could get my hands on, and also breaking my own toys and other people's to see what's inside. So curiosity is something that is important for a scientist. And the curious brain looks, learns, it thinks, it imagines, it dreams, and then it invents. It experiments, it fails sometimes, but there's this positivity about it that wants to know more about the world and about how it works. Now, to be successful, however, you need to be more than just amazed and curious. There is a very crucial link at which point you need to know what is the right thing to be curious about. Because you can be curious about many things, and some of them, from my own experience, are not going to lead you to what we call success in research, and we'll define that a little bit later on. But how do you know what the right thing is about? I think the first choice you really need to make, and these are sort of major strategic point choices that you will make in your life, has to do with the field that you choose. And it should be a field that you really like if you want to do research, and preferably you must love that field. So the natural question that comes to you is, how can I tell? How can I tell what is the field that I like? And here, whenever that happened to me in my life, I had one recourse to go to. I just asked Fuzz. Now I have to explain about Fuzz. And this picture, I think, tells you all you need to know about the amalgamation of the name Fuad Ziyadeh down to Fuzz, which is how I've known him all my life, but you're not allowed to call him that. Only very few people are. And so it was at a crucial point of that kind that my life and his intersected in ways that led to me making decisions. So in our journey, I've sort of divided it into two phases: the pre-renal journey, if you want. And the pre-renal journey is our journey together until we went into nephrology fellowship. Now, it started to differentiate renally at a certain point. We'll get to it later. But during this whole period, when we met at IC in 1970, graduated, did all our medical years, internship in medicine, we were together. But during this period, the things that I learned from Fuzz were not related to nephrology. Here are some of the things that he brought into my life. Now, he told me about, and he sent me a long letter, which I have here, explaining why this is the ultimate transformation of human music. Shortly thereafter, however, he introduced another group to me, which I liked even better than Led Zeppelin. And then he introduced the group I liked most of all from the three. And so for that, I thank him. But in addition, he tried to make me a bit more civilized by introducing me to some of the giants of jazz, which I've also loved since Fuad and I were friends. And to accompany that, he also helped me to appreciate good cognac, which Fuad is known to savor. Now, the combination of all these factors led sometime in the middle of the 70s, during our Med 3 year. And I remember we were at our house, and in fact we were studying together, and Fuad was sort of lying down. And in a moment of dreaming, illusion, he said to me, Kamal, do you have any idea how wonderful the kidney is? And at that point, this was when we started to look at the kidney together and study it, and realized that this is what I love to do. And the extent of this became a bit bizarre when after Fuad we made that choice, and in the first year of our internship, Fuad left for the first time to go to California and work at UCLA. And I was waiting eagerly for her first letter from him. And I got that first letter. And the first letter he sent me was a case of hyponatremia, actually. That's the whole letter. It says, Dear Kamal, enjoy the following case with Ida. She would be interested. I was following up this patient, 43-year-old male, mentally retarded, IQ 50 since infancy, etc., etc. And then he gives you the numbers down here, a sodium of 104. And then a series of questions, which are that I have to do. The sequence of events for hyponatremia and volume depletion. Second, the acid-base disorder. And third, the provisional diagnosis. And then at the end it says, answer fully when I'm back. It's quite interesting and perplexing. And that's it. That's the letter. Have fun. Fuzz. So when that tells you how much nephrology was part of our life, that the first letter I get from him is a case of hyponatremia. So a field that you genuinely love, and here I really owe it to Fuad, the fact that I actually went into this wonderful field that I've loved all my life. But within that field, you also need to pick a question that matters. And here is the vantage point of the investigative physician. In other words, you have to pick a question that people care about, and that becomes an important issue in your success. I'm not going to go into my research, but the problems that I worked on had to do with glomerular inflammation, and it turns out to be something that people are not interested into that much, because not many people have glomerulonephritis. But from that, my research has extended into the general biology of inflammation, which of course is of tremendous influence in so many other fields, including vascular disease. So I'm it is hard for you to imagine that at that point, perhaps, I actually fell in love with the GFR. That concept became to me something I really love to explore, and I will tell you in a minute how that came about. So you have to be amazed, you have to be curious about the right things, and you need to have some skill. In other words, you cannot be what's called a klutz. I don't know whether this is still valid anymore, but when I was training, you could be a brilliant person. And I was training at Harvard, and these fellows would come off the servers with these fantastic ideas that they're going to solve all the problems, and they're coming into Barry Brenner's lab, who's the person I trained with. And if a number of months later, the following conversation will take place. Brenner will tell them, you are fired from the lab, and the brilliant Harvard fellow will say, but Dr. Brenner, why? And he'll answer, because you are a klutz. So you could be a brilliant person, but if you go spend the first 6 months breaking everything in the lab, it's not going to work. So now I don't know how much technical skill is still a part of laboratory work these days. Everything, there's a lot more research you can do. But in my days, you had to do that, and you had to be able to do stuff that is fairly complicated. And that's why you had to wear a bow tie, so that it doesn't dip into the preparation. And that is a habit that has stayed with me since then. Now, to acquire all of these, to be able to be guided through this, the issue of mentoring is very important. And here is where I think one needs to look for what are called good mentors. But who are these good mentors? I think one looks for 4 different types of mentors, if you want. There are those who guide you at major decision points in your life. For example, should I do an MD or a PhD? What general area should I get into? Then there are those who stimulate your curiosity. People who you come across, they stimulate you to think about things, but they themselves may or may not be involved in research. And then you need those who actually teach you how to think and write as a scientist. And these are your crucial mentors who are going to really guide the significance of your research. And then, of course, you need junior mentors who help you with the day-to-day work of, learning how to do whatever you're going to do as a technique. So there are several levels of mentors, and those who guide you through major decision points, they need to be senior mentors to you, and they need to be people, preferably, who know you well, and even more preferably, who care about you as a person. Now, for me here, I want to pause for a moment and mention the person who to me was a major mentor, Dr. Sabra, Fuad Sabra, who is here pictured with Fuad, to whom he was also a dear person, as Fuad wrote once about him. He helped me make decisions when I wanted to do a PhD, and he said, do an MD first and then do all the research you want in your life. And I didn't like the advice, but I took it, and I don't regret it. So these are people who care about you, who are wise and senior, and who give you decisions that will stay with you. But then there are those whom you need to stimulate your curiosity in your own field. And here, Fuad and I share a mentor, Dr. Shwairi, who many of you may have heard of, and who to me was really the person who stimulated me to go to Dr. Brenner's lab and look at the question that I looked at, which at that time was the reason why the glomerular filtration rate goes down to 0 in a child with glomerulonephritis, and then when the leukocytes go away, the GFR goes up. I was very curious as to what made that huge hemodynamic change occur at the time when pressures and flows were normal. And Dr. Shwairi told me, you go and answer that question. And it was because of a patient he had on 9 South who had post-strep that we saw together. Fuad can tell his own stories, perhaps, about Dr. Shwairi, but neither I nor Fuad are the only ones who have benefited from the inspirational sort of stimulatory effect of Dr. Shwairi. Here is the group of very prominent nephrologists, including our current dean, including Dr. Abu Alfa and the late Dr. LeMSIC, the leader of the pathology at the Brigham for a long time. So an inspiring mentor who stimulates people to think, although Dr. Shwairi's publication record actually is very, very meager. He himself has not really published much, but all these people came to pay homage to his ability to stimulate them to go into research. Now, of course, I mentioned about the people you need to teach you techniques. And finally, you should be in the best possible place and environment for research to occur. Okay, now I will stop here. I will give the ground to Fuad, and we'll come back to look at what we mean by success in research and a little bit about friendship.
Thank you, Kamal. 2 kidneys, 2 journeys, 1 friendship. First, many thanks to the LeMSIC SCORI and the organizing students for this really amusing idea which inspired this title from me. And Kamal and I are good friends, but you can see from our different talks now how not just similar, but also how different we are. So allow me first to dedicate this presentation to 2 other kidneys. This is the late Dr. Raja Khouri, former dean, nephrologist, a towering figure in renal physiology who did pioneering work at Yale, in Germany, and at AUB, and who introduced me to the wonders of the kidney when he taught us Med1 courses in biophysics and homeostasis. He was one great role model. Here, during the war, insisting that we should hold an induction ceremony for the new members of Alpha Omega Alpha. I happened to be the chapter president at that time. And tell you a story. Once, Dean Khoury allowed me to take a week off and attend the International Congress of Nephrology that was taking place at that time every 4 years, just like the Olympics. And it happened to be in Athens, and he let me go, supported my trip. We went on strike at the time at the emergency room because we were hit by bombs and etc. So that was a perfect week to take off without losing much. And you can't imagine how important this very first international meeting was for me. Of course, the other gentleman is Dr. Edmond Choueiri, currently Emeritus Professor of Medicine and twice Chairman of the Department of Internal Medicine in 2 periods in the 70s and 80s. Truly a giant figure in clinical nephrology and pathology, and one-of-a-kind teacher. He was another great role model for me. And this picture from the past and from the present, many years ago we got together all the AUB nephrologists in the US, quite a large crowd, and paid tribute to Dr. Choueiri in a special ceremony during the American Society of Nephrology meeting. Of course, you can recognize many faces, including Dean Sayer, Samuel Sanjad here, and so many others. So this is the timeline for my 4 Fs. So 40 years ago, a friendship starts. 30 years ago, nephrology fellowship starts. 20 years ago, a research finding starts a career. And 10 years ago, a family starts. And I'm going to borrow a page from my other passion, cinema, and I will resort to flashbacks and use the technique of starting from the end and go back in time. Kamal, with his wife Lena, Lena being the caring woman that she is, was instrumental 10 years ago in having me start a family, because she invited a woman she had just met, a pediatrician hem-onc specialist, and this was our first encounter. And as they say, the rest is history. Mirna and I were married 2 years later, and so thank you, Kamal and Lena, for influencing the course of my life. And here's a very happy moment for both of us. Kamal carrying my second son, John, who's now 5 years old. And here's the family growing, and you can see my other son, older son, Ilyas, now 7 years old. And here we are as a family going to the AUB commencement 3 years ago. We live in the lower campus, and this was at the time when I was Associate Dean for Academic Affairs here at the AUB. And I want to say, incidentally, in the last 10 to 12 years, Kamal and I played musical chairs. We traded places, and we both came full circles. First, I encouraged and supported him to return to Beirut to become chairman of medicine in 2000. Then he convinced me to do a sabbatical at AUB, and then later to return to AUB for good. And I became associate dean, and then after he left to be founding dean of LAU's medical school, a truly groundbreaking achievement for him. I became chair of medicine, and now that Kamal is back, he is now associate dean, but we are back together as we have always dreamt. So moving back now to 20 years ago, or a bit more, a research finding is reported, and this was all at the University of Pennsylvania in Philadelphia, the only institution I have ever worked at other than AUB. Now, if I know systematic cellular or molecular research being done on the pathogenesis of diabetic nephropathy. So, by a pure accident, a good friend of mine, a Penn faculty member, Stanley Goldfarb, who had just lost his NIH funding at that time because he was just perfusing tubules. He decided to give diabetes research a try, and he encouraged me to do so. So after 7 years of working on obscure topics in epithelial electrophysiology, I retrained myself for more than 2 years in the emerging techniques of molecular biology, which I had no clue about, and started all over from scratch. I needed to do this because the war in Lebanon prevented me from returning to Lebanon, and I had to do something special, ultra special, to switch from the dreaded J1 visa to another status. It was also around the same time that Kamal, whose career was already launched and focused, thought that some prominent figures in the nephrology community would rather see me move away from working as a physician scientist on obscure and esoteric topics like the shark rectal gland or the benzodiazepine receptors in the kidney. You know, eventually I realized that Valium can actually probably put the kidney to sleep, but also your career. So thanks, Kamal, for the tip. So I just want to really go over diabetic nephropathy for like a few minutes and learn from it some lessons along the way. So I'll present some data here. So let me show you first a sampling of what we've reported. And these were even before the results of the landmark DCCT were out, which firmly established the pathogenic role of glucose in diabetes complications. We found, for example, that high glucose directly induces renal cell hypertrophy, stimulates extracellular matrix production such as collagen, and these effects can be reproduced by the recently cloned transforming growth factor beta. And much to my surprise and happiness, these effects were indeed mediated by endogenous TGF-beta activity. Now, I remember to this day when my fellow Mike Rocco, here he is, called me when I was still in Maine, enjoying the summer, working on cell volume regulation. He told me that the TGF-beta antibody had actually worked. And of course, I was so ecstatic, I was so happy, but he was not. He preferred to work on polycystic kidney disease because it ran in his family. So incidentally, I allowed him to complete this work, but also to do work on a mouse model of polycystic kidney disease. And we actually published a paper on this polycystic kidney disease, the first, perhaps, in the renal nephrology literature to use RT-PCR, which was all the rage at that time. Now, not to brag about it, but to get published in the Journal of Clinical Investigation was very important. So you have to choose your journals. Here are 2 of my 4 papers in JCI on the subject, and why not publish in JCI? The tissue culture model that we came up was really considered original, the findings were quite novel, and the results filled a big gap in the field, which was really hungry for a new direction. So I was very lucky. I was in the right place at the right time. And my papers helped my career tremendously at that time because there was really no other big name on my author list. So I became a big name myself, I hope. I personally took the whole credit, and I got my second NIH, which paid for my whole salary support and for my lab. I stayed at Penn. I was promoted to associate professor and got tenured in '94 and was elected the same year to the American Society of Clinical Investigation, known as the Young Turks, which is the major recognition achieved by a physician scientist at a young age in America. And I got my green card. So the natural thing was to go from the bench to the bedside, to the human. And here, a cardiologist friend doing cardiac catheterization took arterial and renal vein measurements, and we proved for the first time that the human kidney in diabetes in vivo produces excess amounts of TGF-beta protein in diabetes. And using specimens from the collaborative study group that showed for the first time the nephroprotective effects of the ACE inhibitor captopril in diabetic nephropathy, we showed that reduction in the high levels of TGF-beta by the drug can predict future preservation of kidney function. But this is not a cause and effect proof yet. So to get direct proof of concept, we went back to the bench. Eventually published a paper in 2000 in PNAS, the Proceedings of the National Academy of Sciences, showing the title, Long-Term Prevention of Renal Insufficiency and Excess Matrix Gene Expression and Glomerular Mesangial Matrix Expansion by treatment with this monoclonal anti-TGF-beta antibody in a mouse model of diabetes, in diabetic DB mice. This paper, incidentally, like the other JCI papers, has received nearly 500 citations to date. And we also confirmed this result of the antibody using a different approach, which is the antisense approach. But to me, this is a finding from the paper, to me more important than the results are actually the tools that you use in the lab. First, you had to come up with an acceptable mouse model of type 2 diabetes, the more common cause of diabetes. Second, we had to have all the tools and the techniques to assess kidney function and structure. And thirdly, we had to prepare and purify a humongous amount of neutralizing antibodies to inject the mice repeatedly at that time for many weeks. And just to show here, using northern blots, the protective effect of the antibody on collagen gene expression. But what was surprising to me and to the reviewers was that the antibody was without effect on albuminuria or proteinuria, which is another cardinal feature of diabetic nephropathy. So here we got a negative result, and a negative finding is always very difficult to prove. So to be sure, we invested in a whole different approach. We used diabetic mice with SMAD3 knockout. That's to say the mice cannot really signal through the TGF-beta pathway for the most part. And there was, in these diabetic mice, without the TGF-beta signaling pathway, still persistence of the albuminuria. So the enigma was, if it isn't TGF-beta, what's then the cause of the albuminuria? We could have stopped here, but it turned out that the factor was VEGF, vascular endothelial growth factor, and the receptor blocker prevented albuminuria. Also, we could have stopped here, but once again, I found myself going into a new area, the mysterious world of the podocyte, which hadn't been studied before, the glomerular visceral epithelial cell. So I raced to work on this cell type in diabetes before the others, and I would say this is now my new area of interest for the past few years. So, a happy, simplified conclusion of nearly 15 years of work. The mesangium in diabetes contributes to glomerular sclerosis and kidney failure. The podocyte contributes to proteinuria and also to glomerular sclerosis and to worse tubulointerstitial lesions in the kidney. So, the mesangiopathy of diabetes is TGF-beta mediated, while the podocytopathy is, at least early on and at least in animals so far, is VEGF mediated. And really, what I'm most proud of is not these findings. I'm proud of the fact that I've trained in my lab no less than 30 postdoc fellows, clinical nephrology fellows who went into research. Many of them spent 2, 3, 4 years in my lab, and they're all doing very well in academia, populating several places in the world, and this is truly the most significant part of my journey in research. And I was just last month in France, invited by the Francophone Society of Diabetes to give a keynote speaker, and I was the only one who had to give a talk in English. And I'm happy to say that a large international trial is now launched to test in diabetic patients the effect of TGF-beta antibodies on the course of nephropathy. That would be a very rewarding and happy moment if this antibody turns out to save lives. So back further in time, now 30 years since Kamal and I went to the States for our nephrology fellowship, here we are at a meeting during winter and during a New England summertime. The deal was that Kamal is sealed in his choice. He has to go and work on the glomerulus, but I had to do something else, go somewhere else, and I had to work on the tubule. Fast forward, this is Kamal much later when he invited his mentor, Barry Brenner, to visit Beirut. For those who don't know or should know, Brenner is by far the most influential living nephrologist these days. And I chose to go to Penn, perhaps the oldest renal division in America and in the oldest medical school in America. And I eventually stayed there for my entire career. Kamal, on the other hand, always had this 7-year itch. He moved from Harvard to Vanderbilt to Emory to AUB to LAU to AUB. And the list keeps going. Incidentally, Kamal, I point out to you, this is Alfred Newton Richards, who in the 20s was the first, who was at Penn, to prove experimentally, meticulously, that the glomerulus actually ultrafilters the plasma. This was the very first proof 90 years ago of this phenomenon. So Penn also worked on the glomerulus, not just Harvard. Here, I'm around that time. Notice the new Mac. I mean, well, this is very important. Can you imagine writing papers or grants now without a computer? And just before that, we had to do that by hand and by old, typewriters. And that had major revolutionary implications for all of us. We don't even feel it today. Much later, here's a recent picture of me with the statue of Ben Franklin, who actually founded the University of Pennsylvania. Here are some people who influenced my career early on. Kamal talked about my elective with Richard LeMSIC at Harvard UCLA in '79. I need to give all the others also credit. They're all very supportive. They were very supportive. And when I reflect back, though, there's something that I miss. I really cannot say that anyone was really my mentor, and I miss that. Even as a fellow, I had to do my own projects with erratic supervision. This was quite challenging, but at the same time also extremely enjoyable. And this may have been a blessing in disguise eventually. Here's my first year after being a fellow at Penn, my first renal division picture. At this point, I just loved clinical nephrology. I never had any research experience before that, and I must admit, I don't think I was even curious about research, and I wasn't sure I was going to go into research. I was not even ambitious, I'm admitting it, to be a researcher. I was just going to go to America to return after 2 years of fellowship and open a clinic when I come back somewhere here in Ras Beirut where I grew up. But this did not happen. I stayed more than 20 years at Penn, and here's my last picture as a tenured professor in the division. I do now miss Philadelphia. I loved Center City, Philadelphia. I miss it a lot, especially the Philadelphia Orchestra and the Cine Club. I must have gone to hundreds of concerts and watched truly thousands of movies while all my other friends were raising families. Now, enjoyably, I rarely go out and I love to be home with my wife and my kids. So I'm a late bloomer in this. So Sinclair Lewis, an American writer, he wrote about science. He said that the ultimate lesson of science is to wait and doubt. I learned this lesson quite well. Because for me, during the war, the lesson was you had to wait. Wait for the Beirut airport to open. And I learned to doubt, and I doubted whether it was going ever to open. Here are the bizarre things that I worked on early on in the first 7 years. A a regulation of sodium transport in frog skin, glands secreting chloride. I described for the first time a calcium chloride co-transporter. I don't think it was ever proven to physically exist. Shark rectal gland, magnesium excretion. We had a hypothesis at that time about Barter's. We worked on the nephron, urinary bladder of the winter flounder, cell volume regulation with organic osmolytes, etc., benzodiazepine receptors. Very diverse subjects, very unfocused. Yes, I was productive though, and I published around 10 papers in very good journals, but these papers have so far received only a handful of citations each. So though the science was solid, and I paid a lot of attention to details, like I always do, but I did not see the big picture. And so science for the sake of science can be good for a while, but what was needed is to do good science as well as to try to make an impact on a common and otherwise devastating disease which is hugely understudied, such as in my case, it turned out to be diabetic nephropathy. So, were these 7 years a waste of my time? Perhaps, I don't know. But I can say that all this physiology that I learned, I think made me a better nephrologist, a better scientist later on, a better, more confident teacher above all. And for example, I truly love teaching now Med 1 courses, and I look really forward to this every year. So knowing all these topics came handy after all in teaching. So it was really, it was really fun to go every summer to Maine, to Mount Desert Island Biological Lab, to rub shoulders with all the who's who in comparative and renal physiology in the world who came for the summer from around the world to work there, where once also the legendary Homer Smith used to work. Here's me with the chief of the division at the time, Zalman Aegis. And inside we were doing some microelectrode work on the urinary bladder of the flounder and the shark rectal gland. I also want to go back to my story with Kamal. Only a trickle of collaborations, Kamal. We rarely collaborated, surprisingly. The very first paper, which is really a letter, was just a symbolic tribute to our love for pathophysiology, for a case that we saw on the wards here on 5 South. The second paper was really, though interesting and I think important, because it married these two areas that he was interested in, the isoprostanes with the area of diabetes that I was interested in. We have this habit, Kamal and I, of only occasionally discussing our own research work when we're together. We usually talk about other things, so work is not always the main subject. And I think we now feel that we should collaborate some more, and as we recently did on this paper from AUB, and I think we'll be working together closely. Now, our friendship, as Kamal said, started 40 years ago, and for the next 10 years in Beirut, from high school to pre-med and to med school, and that was the beginning of the Civil War, throughout residency. We also, along the way, we secured these very crucial 1, 2, 3, many crucial electives in nephrology in the US along the way. So these were truly our formative years, and they were decisive in what we were going to do later. We went a lot of ups and downs along the way, and I think our friendship kept us going. One big secret, I think, for such a lasting friendship to me is that you never judge your friend. Don't judge your friend. There were really a lot of downs for both of us. We both lost our fathers suddenly when we were just in college at that time. During the war, my family lost our business. We had our share of displacement, kidnapping, explosions, immigrations, injuries. Luckily, nobody died, but soon the time came to go to do my fellowship in the US, and my trip during the Israeli invasion started on this stinking, painfully slow freight boat, and I was seasick all 25 hours going into Cyprus. I had just one suitcase and a pocket full of Lebanese lira, which eventually rapidly became worthless. And I really truly believed that I will never be able to return. For Kamal, music started with the Beatles and ended with the Beatles, neither before nor after. And when John Lennon was shot, I had to go to his house and console him. I think that's what a good friend would do. Later came the Led Zeppelin, the Who, and Pink Floyd, and the jazz, etc. Here, I like this picture. Here at Asfuri, doing our psychiatric rotation as bed 4s. Actually, we were taking refuge inside, finding solace from the mad world outside, which was raging with war. So I just want to close this segment by saying that Kamal talks about the fact that I turned him on into the world of the kidney. And I can say that to a large extent, he turned me on into the larger world of academia. Really, Kamal comes from a learned family with a long tradition in academia and with many prominent individuals in his family. Just to mention his late uncle, Fuad Ziyadeh, the father of neurology in the Middle East, his other celebrated uncle, Charles Malik. It was expected of Kamal to go high in academia. I came from a family and from a village with barely anyone graduating from high school. So, my family, my mother, my 2 older brothers struggled, and I eventually graduated as a physician. But thanks to Kamal, I observed his impressive trajectory all along, and I can say that I must have learned from him and from this trajectory quite a lot, and I keep doing so. Thank you.
It'll be over soon, guys. Okay. Well, I think that what I would like to end is it's almost like we planned this, but we never talked about it before. I think Fuad has already shown you what success in research really means. I just wanted to give you a little one slide nugget on what I feel is success in research. If your work was valid, then I think you've succeeded in research, even though it might be about Valium and the shark rectal gland. That's okay. As long as it's valid and it's solid, you've succeeded. If your research yielded new knowledge, you've succeeded, even though the knowledge may not have been cited, but still you've added new knowledge that someday may be cited if people look at it in a different way. Who knows? That others build on your results. And this is where Fuad referred to citations of his papers, and I think that this is actually, at the end, the real measure of success. Is if what you've done means something, then people will build on it and do something else based on your work. And that's where citation comes from. And so, if, however, what you've done is nice, but people are not interested in it, they're not going to build on it, even though it may be true. First, it would be wonderful if your research also benefited humanity. And I think, looking at Fuad's work, you can answer that all 4 questions are potentially coming to a positive answer. But I think if any one of those answers is positive, then you have had a good research career. And the most important question is, did you enjoy the journey? And I think that's, without that, research becomes a burden rather than a joy. And it always helps to travel with a friend, you know. And so at the end, I have some more of these pictures from the long time ago. And this is, again, 30 years ago, our graduation from medical residency, right outside where we are today. And our ASN, Chicago, 1982, the classic picture that was shown before. This is, these are just going to be some slides about one of the joys of being in the same field with a friend. You get to travel together to different parts of the world because that's where the renal meetings are. So here we go. Fuad told you that he was working on. I used to go visit him in Maine, mainly to eat the lobsters, and we're eating off the back of our car here. And you've seen this one before, but you haven't seen this one with the pretty legs. Here's France, and with some wine and nice company, and Fuad in a moment of reflection afterwards. The other is meeting old classmates and friends. Here we are with an old classmate, Dr. Chinyara, Arbus de Bustros, eating mussels or whatever in Baltimore. And I have no idea where we are here. But one thing about Fuad, that whenever we went to a city, he always insisted on visiting the museums. He always enjoyed the museums. Now, the one thing that you don't know about him is that he's a poet. I have a whole library of his poems, and one of them he dedicated to me at one of the times in my life when I was having a hard time. And I thought I would just show it, although I'm not going to read it because it's a bit sad. But it's a gift from him to me, which I value and I treasure, and I thank him for it. Well, this is the way we looked when we graduated. Look at Fuad's expression on his face. He really looks like he has no idea where he's going next at the end of his graduation. But Fuad, it was a pleasure to travel with you, and I'm glad we came so far, so well. Thank you.
So, just like David Letterman, let's give you my 10 tips on becoming a researcher. It's never too late to start research. For me, it was quite late. Also, it's never too late to switch topics in research. For me, it was also very late. Seek a mentor. I didn't have one, but I think it's crucial. So just find one, and not just a role model. There's a big difference. Have a passion for your work, that's a must. Be patient, this is a marathon and not a sprint. And don't put your life on hold. I don't think I did. Maybe I did one thing at a time. I should have done 2, 3 things at the same time, being a multitasker. At that time, I wasn't. Differentiate yourself in an area that you claim your own. Let serendipity take its course. I don't think we ever can tell what will happen to us, and things happen by chance, and just make the best out of them. But always be the best you can be. You know, if you're doing a clinical rotation, if you're, I was appointed at one point the co-director of the stone clinic, the kidney stone clinic, and I became like, an expert on that field because I liked to be the best that I can be in whatever one was asked to do. But of course, have a good friend to lean on, and that's the number 10, probably the number 1 tip. Now, what about this brain drain? Everybody is going to travel and maybe go and not come back. This is the story of the Lebanese. I think the answer should be "Shu waqfet alayyi." Old friends, bookends. This was a very famous Simon and Garfunkel song we used to hear in Med 1 Lounge, Med 2 Lounge. You know the song, and it probably is somehow reflective of this theme of our friendship. And when we were students, we came up with this magazine that we called Trauma, to take place of the other magazines that were defunct. I also wrote a poem called Trauma at that time, which eventually I got published, and this is just a piece of it, and I will read it, and it describes myself in the way I see myself. Far on that butterfly wing, I rank myself as a vanquished curiosity. Even the glittering sun is aware of that as I cast my own shadow onto it. And though I burn, yet I do not shine, but I get myself warmth and all. So is it FZ or Fuzz? I will allow some people of you to call me Fuzz. Thank you. Is there a burning question from the audience?